You have a similar diagram showing the superior mesenteric vein and the splenic vein joining together to form the hepatic portal vein in my human anatomy lecture outline on page 014, the top diagram. So then you can go and check it out and see that that's what it is. Okay, let's stop. This is page 014. Here you can see the splenic or renal vein. We'll just call it splenic from the spleen. Here's the superior mesenteric vein bringing blood from the intestine. They join together to form the hepatic portal vein right to the liver. Notice it looks like an upside down Y, and that's what we saw in the cat just a moment ago. All right. Now we're going to look at the arteries, some of the blood vessels. This is the heart. Coming off the heart, this is the aorta. And here we can see the aortic arch. On the cat, there's two arteries branching off the aortic arch. The first one is the brachiocephalic artery. The second is the left subclavian artery. We'll come back to those later. As the aortic arch bends down, it becomes known as the thoracic aorta as it descends down through the chest. The thoracic aorta goes through this diaphragm muscle, and it comes out into the abdominal cavity. And here, not real bright red in this cat, but this very obvious because of its size, this is the abdominal aorta. There are three major arteries branching off the abdominal aorta that supply the digestive tract. This first one, this huge one right here, coming right off near the beginning of the abdominal aorta, is the celiac artery. There are two significant smaller arteries branching off the celiac. A gastric artery supplying this stomach, and this happens to be an especially large stomach, and the splenic artery supplying the spleen right here, the spleen of the cat. Now, in many cats, there's more than one splenic artery, but clearly we name the arteries based on which organ they are associated with. Splenic artery associated with the spleen, gastric artery associated with the stomach, both coming off the celiac artery, which was the first branch off the abdominal aorta. This artery, the next branch off the abdominal aorta, is the superior mesenteric artery. The superior mesenteric artery subdivides into many, many smaller branches, supplying blood, oxygenated blood, to all of the small intestine. And you can see all these branches in the mesenteries of the small intestine. The mesenteries are the name for the membrane that holds these loops of the intestine together. There are other arteries branching off the abdominal aorta. Here, this is the renal artery branching off the abdominal aorta right here that goes to the kidneys. But in terms of the third artery supplying the digestive tract, it's this one right here, the inferior mesenteric artery going to the large intestine, the colon or large intestine. So in a kind of wide-angle view, celiac artery to the upper part of the abdominal organs, the superior mesenteric artery to the small intestine, the inferior mesenteric artery supplying the large intestine. At the bottom of the abdominal aorta, it terminates by bifurcating or dividing into a right and left iliac artery. Now in the cat, slight difference from human, there is an external, a right external, and a left external iliac artery. The internal iliac arteries are a little bit lower down in the cat. They're right down here. They supply, the right and left internal iliac, supply oxygenated blood to the organs of the pelvis. In us, slight variation, there's a common iliac that then bifurcates into an external and an internal. But again, in both cat and humans, the external iliac carries blood to the legs, the internal iliac carries blood to the pelvic organs. And if we follow this external iliac right here, this is the right external iliac. As we follow it into the upper part of the leg, the thigh, its name changes and we call it the femoral or femoral artery down here. Of course, next to it would be the femoral vein. The veins carrying blood back towards the heart. Follow the femoral vein up. It becomes the external iliac vein. Here's where the right external iliac vein, here's the left external iliac vein. They join together, and that's the beginning of the inferior vena cava. This huge vein, the largest vein in the body, is bringing blood from the lower part of the body. It's heading upwards. It goes up through this diaphragm muscle, and here it is here in the chest. This is the inferior vena cava, bringing blood to the heart, right here. And up here on the top, this kind of broken, is the superior vena cava. And I'll show one last vessel here if it's not broken. No, I'm not, because it's not there. All right. I'm going to review the arteries and veins in the chest area very briefly. So let's start with the veins, since that's most apparent. This is the heart. This large vein right here is the superior vena cava. The superior vena cava is formed by the confluence or joining together of a right and a left brachiocephalic vein. Brachiocephalic, of course, means arm-head vein. So each brachiocephalic is in turn formed by the joining together of a jugular vein, bringing blood down from the head, and a subclavian vein, bringing blood from the arm. So you can see the subclavian vein and the jugular vein joining together to form this right brachiocephalic vein. This is the left brachiocephalic vein, and the same thing's going on this side. Now, in terms of the veins, and this is not too clear right here, it's been somewhat broken, but we would talk about a brachial vein, an axillary vein, and over here the subclavian vein, in that order. Now, if that's a brief review of the veins and just a couple of other things, following the superior vena cava, there is a vein right here on the side called the Azygos vein that connects up with the superior vena cava. This is comes up along the vertebral column, not too well injected, but this is an alternate pathway for the blood from the lower part of the body to get back up to the heart. Of course, the major pathway for the blood from the lower part of the body to get to the heart is the inferior vena cava.